Did you know the first robotic cataract surgery has already been performed on a human in 2025? Robotic cataract surgery. What is it? What's happening now? And what may come next? First of all, this is not femtosecond laser-assisted cataract surgery, which many surgeons have been using for years. My name is Marc Shomer. I am a board-certified cataract surgeon, and I'm a clinical instructor of ophthalmology at the Doheny Eye Institute at USC. Cataract remains the leading cause of global blindness, affecting nearly 94 million people worldwide. The procedure demands exceptional human precision in navigating structures measured in microns. If you have heard the phrase robotic cataract surgery, you're not alone, and it can mean a couple of different things. The simple idea is this: the cataract surgery is already one of the most precise surgeries in medicine, and robotic AI, or artificial intelligence, aims to make it even more consistent in even more challenging cases while keeping the surgeon firmly in control. The world's first human clinical trial of robotic-assisted cataract surgery has recently been performed in late 2025 by the Horizon Surgical Systems Polaris platform. 10 patients underwent robotic-assisted cataract surgery with no adverse events reported in the initial study. What is cataract surgery? A cataract is a cloudy natural lens inside the eye. During cataract surgery, the surgeon makes tiny openings in the clear front window of the eye called the cornea, then makes an opening in the thin bag that holds the lens, which is called the capsule. The surgeon then removes the cloudy lens and places a clear artificial lens, or an IOL, in its place. Laser-assisted cataract surgery, sometimes marked as robotic, is a term which has already been used for many years. A femtosecond laser can perform certain steps in a computer-guided way. Specifically, the laser can make incisions in the cornea, it can create a circular opening in the capsule holding the lens, and it can soften or fragment the cataract lens before the surgeon manually removes the fragments. After these preliminary steps are performed, the surgeon then uses their own hands to complete the cataract removal and lens insertion. So what does robotic cataract surgery actually mean? Well, true robotic-assisted intraocular surgery is the new frontier. Here, the surgeon may operate from a cockpit or a console and control robotic arms which are holding microsurgical tools. The goal is to reduce the limits of the human hands, like tiny tremors, and add features such as guidance overlays, tactile force feedback. Yes, human work has already started, a major milestone. In the late 2025, UCLA-affiliated researchers and clinicians reported a first in-human clinical study where 10 patients underwent robotic-assisted cataract surgery with no adverse events reported in the initial experience. The surgeons were Uday Devgan and David Gural. The lead developer was Dr. Jean-Pierre Hupschmann, MD. I had the pleasure of working with both Drs. Hupschmann and Devgan while I was at the Stein Eye Institute at UCLA. They were both amazing surgeons. So how does the system work? The surgeon sits at a nearby console and sees a 3D view of the eye with computer guidance overlays, tactile feedback, while robotic arms manipulate tiny instruments to perform the key steps of the surgery. Polaris is marked as an artificial intelligence supported primarily through AI-enabled visualization guidance integrated with robotic control. With the surgeon operating the system, artificial intelligence helps process real-world information during the surgery. It identifies key landmarks and tracks the anatomy, can help mark the anterior capsule edge, the lens equator, the posterior capsule. It can also keep track of the instrument tip location, create visual overlays or guidance cues for the surgeon. Think of an analogy like a car's heads-up display. Driving at night in poor visibility, or where there's nearby cars, it can mark everything for you. And in situations where there's potentially harm, it can give you a warning or you actually slow down the car. Instead, artificial intelligence helps maintain spatial accuracy, alerts proximity to sensitive structures, stabilizes the motion or filters the tremor of a hand, supports consistency during high precision steps. While I'm performing traditional cataract surgery, I'm usually seated right next to my patient. With robotic surgery, the surgeon can be on the other side of the room. They can see everything in sharp 3D view and control surgical instruments with an extreme level of precision and control. The back of the capsule of a cataract is 2 to 4 microns thick. Just in reference, this is 20 to 40 times smaller than a hair, or roughly the same thickness as a spiderweb. Cataract surgery requires precision. The key numerical achievement reported by the robotic cataract surgery team is a tip tool accuracy of around 0.05 millimeters, which is the level of micro precision far exceeding human capability. What could robotic cataract surgery improve on if it delivers on the promise? Consistency, making key steps like the capsular opening and lens positioning more repeatable from case to case. Precision in difficult eyes, which have small pupils or weakly supported cataracts or very dense cataracts, situations where the margin of error is very small. Better ergonomics for surgeons, less physical strain may matter as surgical volumes increase. In some countries, there is a lack of access to cataract surgeons, and this might one day offer surgery to people in need. If this field keeps moving, here are some plausible directions. Complication avoidance systems. For example, in cars, if it senses an impending crash, it may automatically slow down before the driver is even aware. In robotic cataract surgery, the system might have additional safety measures to prevent certain types of complications. Real-time imaging and artificial intelligence guidance inside the robotic cockpit. Think of the Iron Man helmet, which has artificial intelligence guidance and additional information. The system might give real-time information on the best place to make an incision, how centered is the lens, and what tissue plane the instruments are actually in. More personalized lens placement for premium lens outcomes, especially for lenses that are sensitive to centration, tilt. Tiny improvements in positioning could matter a great deal. As of the recording of this video in December 2025, there are no commercial use of cataract surgery, and this will remain in clinical trials for many years. If you hear surgeons using the term robotic for cataract surgery, it is likely femtosecond laser-assisted cataract surgery. In the end, the visual outcomes of robotic cataract surgery are not likely to be a huge difference because in manual and robotic cataract surgery, the cloudy lens will be removed and replaced with a clear lens. Eventually, the robotic surgery might have a safer risk profile with less complications. It's scary to think about, but maybe even one day a machine will replace the surgeon and AI will perform the surgery through these robotic tools. Thank you for watching. Please comment below if you have any questions. Please like and subscribe for more. Thank you for your time.